Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Raj, thank you so much for joining me today for NCPDP Unscripted.
It's a pleasure to be here.
So how long have you been an NCPDP member?
So I think now it's going on 3 years with the
3
NCPA
years.
Foundation grant.
Nice, that's great. Thank you so much for staying involved and being engaged with us. It's been so nice having you. So tell me a little bit about what made you interested in becoming a community pharmacist.
So I'll say, I think anything professionally you do in your life that you're actually going to succeed at, you have to have a good mentor. So I think what I got pushed into community pharmacy was I had really good mentors that actually started me as a pharmacy technician when I was working in a retail store. And then from there, they kind of just stuck with me through pharmacy school and then through my professional career. And even leaving my professional career and starting my own business, I always lean on them for advice. So I would say the reason why I'm a community pharmacist is because I had great people around me. So, I still do with NCPDP too. So.
Yeah, that's awesome. It takes a village, doesn't
Yep.
it? So as a community pharmacist, how does technology influence what you do?
So I saw when we were talking about this earlier off the on the side, pharmacists in general, I think, are just technologists in general. We, with NCPDP, the standards and how we're utilizing those standards, if you go out in any other sector of healthcare, it seems like we're really, really far ahead in just how we adjudicate scripts and how we utilize pharmacy operating systems. You have to be pretty in tune to technology. So when I got into pharmacy was my core and my foundation, what I was learning, but one of my peers told me that, hey, you need to find something else and enhance that, and technology was where I kind of migrated to. The funny comment was, you're saying I'm a technologist. My brother's watching this, he'll probably be laughing right now saying that he's not a technologist, but it's an interest I had, and I've just continued that over the years.
So how do you see the role of a community pharmacist evolving?
So when I got out of school, it was, we were still going back and forth on whether a technician could label a vial. And now we've gone to the point where technicians are running pharmacies all on their own, and technology has a lot to do that. When you have a technician running a pharmacy and you have a telepharmacy platform where there's a pharmacist verifying DURs or validating scripts remotely, that's an enhancement in technology. I don't think it's going to stop. I think it's going to accelerate considerably in the next few years, especially with automation. AI is just starting to start the process in the pharmacy world, and there's a lot of abilities where it can start to grab and find gaps and close those gaps versus a pharmacist scrubbing through charts and through prescription profiles to be able to identify what those gaps are.
Yeah, so you mentioned AI. That's such a hot topic pretty much everywhere right now. So can you tell me a couple of the ways you think AI is really going to impact community pharmacy?
Yeah, so I think it first starts with automation. So taking kind of the sludge that happens in the pharmacy space when it comes to just a simple thing like prior authorization or identifying gaps in care. There is a way to use automation in not only identifying any gaps, or as well even just data entry or some of the administrative tasks that take up 80% of a pharmacist's time or a pharmacy technician's time. I think as we continue to evolve, you're going to start to see AI start to come in that where it's starting to then have a little bit of non-judgmental tasks that it can take off the pharmacist and technician's plate. Like, for example, matching up a patient that may be over the age of 45 that's identified that needs to get a colonoscopy. Well, it can flag that immediately for the pharmacist, and then maybe in addition to that, as the pharmacist have that conversation with them, go through the whole process of scheduling that referral for the patient and then following up to ensure that the patient completed the treatment. So.
Sure, which brings me to something that is very near and dear to my heart, is seeing pharmacists grow into more of a clinical role and being recognized more as clinicians, right? So how do you see technology supporting that?
One, I'll say pharmacists are probably the most accessible healthcare provider
Absolutely.
throughout the country.
Yes.
And
Well
as,
proven.
Yeah, and
Yes.
when there's a crisis, pharmacists are always up there at the front to be able to handle it. We've seen that
Yep.
with H1N1. We've seen that
Yes.
with COVID.
Yes.
God forbid any other pandemic comes, pharmacists are right there ready to move forward. I think with technology, it'll start to help where we have this shortage when it comes to PCPs as well as pharmacists. We can augment technology to actually have a pharmacist somewhere where there may be a pharmacy desert, and utilize that pharmacist for any clinical care that, via a phone or via a system where the patient can walk into a treatment center or a clinic center and have a virtual pharmacist to engage with.
Yeah, I think those are really great points. I'd also love to hear your thoughts on how we can use technology and especially NCPDP standards for better giving clinical information to the pharmacist that they can really actually step into that role and improve that patient access to care.
And say like pharmacists in pharmacies, when we utilized NCPDP standards back in the days, that the real-time validation that we got with NCPDP, a lot of other clinicians didn't have that. That two-way street going back and forth, where if we're getting information coming from the clinic to the pharmacy via the standards, the ability to then take specific codes and push it back to the clinician through the pharmacy. I'll give you a perfect example. Transition care, right? So when it comes to transition care, a patient will get discharged. They may be one of our pharmacy's patients. It takes usually around 4 to 7 days before the pharmacy finds out that patient was discharged. If we were able to use high-tech as well as EHR systems information, push that through the standard where the pharmacist is notified in real time immediately that the patient's been discharged, here are the medications, follow up with the patient, we could do a lot to minimize rebound care that occurs when that patient is either not adherent or goes back into the hospital system. So that's one very simple example.
Right, and all great example. And there's just so many ways that pharmacists can really step in and help with patient access to care, back to your point of filling in those deserts, and really improving our public health too, right? So let's switch roles a little bit, or maybe not switch roles, but switch paths. So I heard you do some mentorship programs and scholarships as well?
Yes, so I will say, like I said earlier, I'm in the profession because of great people around me, and I feel it's my responsibility to ensure that I assist and help bring the next generation of leaders that are going to be in our profession. And one thing is, this group, the pharmacy students, they're very unique, and they're a lot more intelligent than when I graduated pharmacy school. I mean, the amount of data that they can consume and then go through and utilize, I mean, there's no way I could have comprehended that back, 25 years ago.
Yeah.
But in addition to that, tying in the experience we have as pharmacists that have practiced for a long time is not only taking that huge amount of data and then screening through it, but then now how do I tie that with the service-based people approach, patient care approach? So with the groups that we mentor, I always say, pharmacy is important. You've got all this data that you're going through. That's your foundation. Find another area that interests you. If it's technology, data informatics, whatever, take that and enhance not only yourself, but then use that to enhance the profession. So we work a lot with universities in Texas.
Okay.
In addition to that, we do have a mentorship program when it comes to our pharmacy fellowship program. But in addition to that, we even go further to, prior to going to pharmacy school, going into high schools and talking to individuals about pharmacy and allied health.
Oh, that's so awesome. So how do you see the future of pharmacy changing for these students that you really help mentoring?
I really think that pharmacy will coin a new term as to pharmacy primary care.
I love that.
Yeah, well, and I really think we all should embrace that. I think pharmacists are trained to, really fill these gaps, and we're skilled with a very little bit of an upskill that's required for our pharmacists that are out there. And that concept of pharmacy primary care, we've got pharmacists in rural areas that are supporting their communities. It's now time to maybe enhance the ability of allowing them to do more, as well as compensate them appropriately for the work they do. I honestly feel you spend $1 reimbursing a pharmacist fairly, you're going to get 100 times more in value when it comes to the healthcare system.
Absolutely. I was actually just reading a research study the other day about how burnout is so prevalent among not only pharmacists but physicians too, and I think COVID just exacerbated that like crazy, right? And so this research study looked at how including pharmacists in the care team actually reduced burnout for them and for the providers. And so it would be great to see more of that happening to where they can really provide each other that support.
In our pharmacies, we have a group of 9 pharmacies in Texas. They're with primary care. Our providers on that side, our physicians, our NPs, our PAs, they want to be able to utilize the pharmacist to the full scale of their license, and sliding scale dosage, therapeutic changes, pharmacy adherence. They push that all to our pharmacists, and our pharmacists take care of all of that, and they're very grateful for it. So they can handle higher skilled items that they may not be able to if there wasn't a pharmacist on staff.
Well, I think it's about time to wrap it up for today. Thank you again for joining me. It's been so nice talking to you. I'm just going to ask you one more question, put you on the spot a little bit here, but tell me one thing, personal or professional, that you're just really proud of accomplishing over the past, 6 months, year?
Well, I will say what I'm probably most proud of is my 2 daughters. So they're growing up to be outstanding young ladies, and I honestly feel that they get a lot of help from Dad about grades and about everything, but they're turning out to be very, very excellent women. So
Well, they have an excellent leader in front of them.
Thank you.
Thanks again for joining me.
Thank you.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.